Hi, my name is Vicki Bodner. I'm from the Cleveland Clinic Wellness Center, and the massage therapists here have gotten together with a few helpful hints for you to use during this time while you're at home to help relieve the stress in your body and also in your mind. The first thing I want to show you is we have, like if you have tennis balls at home, if you can get a hold of those, you could put them in a sock just like this. The other thing that you could do if you wanted to was to buy this kind of ball. This is called a rock ball, but they have different kinds. You can buy these online. And what you can do with this is you can actually lay on the floor and put the back of your head, and we'll have Katie demonstrate that in a few minutes, just like this. Do you want to cut? You'll take the balls in the sock, place it underneath your head. It's placed on the occipital protuberance, which is the two raised spots on the back of your head above the neck. The head will rest right on the balls. There'll be two spots. And just lay there for about 5, maybe 8 minutes. Breathe and relax into it. This is a sacral wedgie. You can buy them online, and it's great for lower back pain, glute pain, sitting a lot. It totally relaxes the spine and the sacrum. Also would probably be helpful with sciatica too. What you do is when you purchase this online, you can take this and put it underneath your sacrum. You'll roll over and you'll be able to feel your spine coming down. And right above the buttock area, you'll feel where it kind of stops right there and the buttock starts. So this will set right underneath there. Can you roll back? And it may need to be adjusted. So Katie, do you need to adjust that? You just lay with it for, again, 5 to 8 minutes is good. Allow your sacrum to relax by breathing. Nice deep breaths. This is a Theracane. You can also buy this at the Wellness Center and online. And what you would do with this is a great tool. I'm going to hand it to Katie to show you how to release pain in your back. So she's going right up to the upper part of the scapula where the traps come in and touch. And that's oftentimes where there's pain and discomfort. You can just gently bring that Theracane, the knob, right into the area. When you feel the pain, you can push in. She's using the leverage over there to pull it forward. She can get as deep as she wants or as light as she wants. And so you can see how she's moving around. She's moving the muscle and releasing the trigger point that's in that area. It can be used all the way up the neck, the shoulder, the scapula, even on the near the spine. You never want to go right onto the spine with anything, no pressure. Just near it is okay. She can even take this and use it up into her neck area. So underneath when you get to the back of your head here, you have your occiput, and it comes down. That's right where your hairline usually stops, and you'll feel the bump where you come down from your skull and it kind of comes in. In that occiput area, oftentimes we have a lot of stress and we hold a lot of tension there. That can have a lot to do with headaches too. So you want to get in there like Katie's doing and push in here gently. You can do little circles with your fingers if you like this, digging in if you don't want to use the Theracane. And just release all of this area, all the way into this area here, the upper traps. That is so comforting and it feels wonderful. You can also use the Theracane on your glutes, and Katie's going to show us how to do that. You take the hook part, and you want to probably start in the middle of your buttocks, right in the middle of where your jean pocket would be. That's where your piriformis is, and that is a very important muscle. Releasing that is going to help if you have sciatic, or it will also help with any hip issues, hamstring issues, anything that would be tight even in the lower back. It's a great place to start. So you just take the Theracane and you're just going to move it around and push in there. You will know if it's painful. Don't push so hard that the pain is too much. You want to just start with the pain a little bit at a time and use your breathing. As you breathe, that helps release the muscle and relax it. You can take the Theracane around and work all the way around your hips here so that her hip is right here, and we're going into the tissue, okay, the muscle and the soft tissue. And you can do that. You can bring it up here. And you can even go up into your lower back over here around the lower rib cage area. But again, you want to be gentle with that. You want to make sure that you are not putting so much pressure on that you're causing any pain or making anything very sore.
Okay, hi. I want to show you a stretch to help with the tightness and soreness that people often feel in the neck, and upper back, and shoulders. So this is one you can do sitting or standing. You can do it as often as you want. There's no rules. Starting with a standing position, so you want to just take a deep breath in and then relax your shoulders down. Bring your arms down to your sides. One of the keys is to turn your thumbs backwards. It changes the position of the upper arm in the shoulder joint. So keep your thumbs pointing backwards and then reach back as far as you can comfortably, just so you feel some nice stretch across the upper chest. And then take a deep breath, make sure your shoulders are down again. Bring your shoulder blades together in the back. It's okay if you bend your elbows. And then squeeze. 1, 2, 3, 4, 5. Stop and take a breath. And then you'll be able to reach back further. So reach back further again. Squeeze the shoulder blades together. 1, 2, 3, 4, 5. Take a breath. Reach back. Squeeze together. Shake it out. That's all there is to it. Hi, I have a technique to use to help when you have pain in your, usually middle, anywhere in your back, along the sides of the vertebrae. Those muscles are called the paraspinals. Very often get trigger points, cause a lot of discomfort and sensation of tightness and immobility. So one of the ways you can address that is with a tennis ball. I put my tennis ball inside of a long sock. Helps for you to be able to hold the ends of the sock, and then you can move the ball around and get it in the right position. So you can do this against a wall or lying on the floor. The only caveat is if someone has osteoporosis, do not do it lying on the floor. That would put too much pressure on the vertebrae and ribs and the joints. In that case, if you have osteoporosis, against the wall only. But for today, we're going to show it lying down. So I'm going to keep my knees up. It takes some of the pull off the lower back. I'm going to take my tennis ball, position it along the vertebrae. I never put it directly under the spine, only along the side, but I can hold on to the ends of the sock to move it where I want it. I want to put it in an area where I feel the most tenderness, and then depending on how much pain you have, sometimes you can't allow much pressure on it. In that case, just only have as much pressure as you can tolerate, and just hold and wait. Usually within a minute or so, that tenderness will dissipate, and you can allow more of your body weight against the ball. Sometimes you have to move it around, find different places. That's okay. It's a little trial and error, but it works really, really well. Usually within about 5 minutes, you can feel a big difference. I would never do it for longer than about 4 or 5 minutes though. If you haven't gotten relief in that amount of time, you should just stop, wait, come back to it later. I'll demonstrate a way to get to those tight spots that sometimes people get under the shoulder blade. Can be very annoying and frustrating, cause a lot of referred pain throughout the shoulder. So one way to do it is to position your thumb up into the armpit. You want to reach forward, See if you can get to that tender spot. Sometimes you have to extend that arm a little bit more, but keep pushing up into the shoulder blade. If that doesn't work, sometimes it works to bend over, let that arm hang. It'll pull the scapula forward, and you can reach that thumb all the way up underneath it. Hopefully that'll do the trick.
We have another stretch against the wall that's very easy for shoulders that are tight or uncomfortable. All you have to do is just turn sideways to the wall, put your hand all the way down to your elbow on the wall, and allow yourself to just bring your hand straight up gently against the wall and lean into it. Allow yourself to stretch as far as comfortable. Don't overstretch that there will be any pain. This is a very relaxing and a very good technique to allow the shoulder, the arm, and the whole side to relax. If you do not have a Theracane, you can purchase any different kinds of Theracanes or different canes on the internet, on the web. Or you can get creative. You can also use the end of a wooden spoon, and you can use that in your glutes, in your occiput, or any places that you can reach with that. Not that, just the handle part used. Also, you can use a kid's ball, any kind of a baseball or softball or some kind of sports ball, and you can sit on the floor, put this underneath your glutes, or even on your legs, on your calves, on your feet, or against the wall for your back, and you can just roll it up and down on the pressure points that you need it. We thank you for your time, and we look forward to seeing you again, and we really appreciate you here at the Cleveland Clinic Wellness Center. Thank you.